So we're going to talk about ketamine bladder today, and we've got Georgina Wilson, urologist, with us to talk about it. So, Georgina, are you able to tell us about ketamine, first of all? What is ketamine?
Yeah, so ketamine is a drug that's used in the healthcare industry, mostly in the veterinary industry, as an anaesthetic agent. So what it can do is cause euphoria as well as sedative properties. But more of late, the reason we're talking about it is because it's become a drug of choice for the younger population, particularly those aged between sort of 15 up to sort of 25 and onwards, as a drug choice for going out partying and also for some of the sedative effects that it has.
Okay, and how does this specifically affect the bladder?
Well, we know that ketamine is quite a complicated agent. It works in the nervous system in the brain, which is why it causes the symptoms, that the positive sides that people want to take it for, but it has a negative effect of when it's got rid of it from the body, it's excreted in the urine. And the urine itself then has the breakdown products of the ketamine, which causes the bladder to become inflamed. And what that can manifest with is, for people taking it, is they can get urgency, frequency, so they need to pee more frequently, and also quite a lot of bladder pain. And unfortunately, that can sometimes mean that people take more ketamine to try and control the pain that they have from it. And we know that these bladder symptoms can happen up to 1 in 3 people who take ketamine.
So yeah, gosh, so that's quite a high percentage of people that take it end up getting the symptoms as well. And what can be done about these symptoms?
So the most important thing for ketamine bladder is stopping the ketamine, because we do know that it's the breakdown products in the urine that causes the problems with the bladder and the irritative bladder symptoms. And we know while you carry on taking that, the damage still carries on happening. So the most important thing for people who have taken ketamine, who may find it psychologically addictive, is they get support. And the support they need to get through is through our drug rehabilitation services, which can provide huge amounts of support, as well as psychological support, often sometimes pain support as well, so that people become non-addicted to it. The key, though, for us as a urologist to be able to manage it is that people have to stop the ketamine, and without stopping the ketamine, any medication that we may give or try will not work.
Okay, so the most important thing for bladder symptoms, if ketamine has caused the issue, is that they need to stop it first for the symptoms to start to improve.
Absolutely. And once they've stopped it, then often their referral through to urology at that point means we have got some medications and some other things in the market that can help with some of the symptoms they've got. But the key is stopping it early enough, because we know not only does it damage the bladder, it can damage the kidney tubes that also collect urine, and it can lead on to get kidney failure for patients long term, which provides a huge amount of burden to them, and also a lot of body image changes that can happen if we have to intervene and do surgical intervention.